Good afternoon and welcome you all for this today's talk about the demand generation and the capacity building. Demand generation and capacity building. Like demand, first of all, the first half is the demand generation. Now, whenever you start a eye hospital or where you have an established practice, now you have some competitors in your vicinity and then really you want to have your show, you want to run your show. So that is basically you have to generate the demand. Like the patient should come to your hospital, patient should seek treatment and then they should regularly visit hospital. So how to generate this demand? This is also for the newcomers or for the established practitioners who are getting competitors in their nearby area. So that is first reaching the unreached, and second approach is the reaching the reached. Now in the first is reaching the unreached. Now you have to reach where you have not reached. So by active camp screening, fixed facility services like the vision centers in the vicinity and outreach services and referrals. So you should get good referrals. So this technique is the reaching the outreach, then unreached. Then of course, as you all know, the cataract is the main cause of the problem with the vision loss. Then apart from that, glaucoma, diabetic retinopathy, refractive errors, and we have to think beyond the cataract. Now whenever you are doing a service, cataracts everyone is doing, but your hospital, what specialty they are doing, so that is also quite demanding. Like we in Pune, there was no oncology department, and all medical college also they refused the managing such patients. But then we started recently with the department of the ocular oncology, and we are getting good referrals from all the hospitals. So that is the reaching the unreached, and where services are really needed. Of course, cataract and all other services that you have to take care of. Then reaching the unreached, again the corporate tie-ups are important, insurance tie-ups are also very important. Certain schemes like the government and the non-government organizational schemes we have to do, industrial tie-ups and tie-ups with other sectors like school, colleges, banks, housing societies and clubs to get the patients, to get the clients. So that is very important. Then the development with the certain NGOs like CBM, Orbis, HelpAge, and the documentation, the report generation, vision building workshop, then that sort of a hard work is also important. Now marketing. Now there are certain norms laid by the government and the other NMCs, and also directly we cannot do open marketing, but then indirectly we have the conventional marketing strategies, digital marketing and mass media marketing. So whenever you want to market, you don't market about the name of the surgeon or the facility, but then what new has happened, what new has come, what new machine has come, that you can advertise and you can market. So then no one can take objection, neither your contemporaries who are there in the hospital, they will have any objection to that. So that is a different, or that sort of a strategy you have to imply as far as marketing is concerned. So these are all about the marketing strategies. Social media marketing platforms, they are easily available, and mass media is also available. Now the second thing is about the reaching the reached. Reaching the reached means the already a patient who has come to your hospital. Now again you want to attract that same client, his or her relatives, the patient from their nearby area. So that is the reaching the reached. So for that you have to have your good ambience, satisfaction of the internal customer, good infrastructure and sophisticated equipments. That is all. So reaching the reached is again a good clinical care you have to give, of course. Then the rational diagnostic procedures. It is not that you have got a OCT and unnecessarily you keep on doing OCT for all cases. So after certain time people will realize that this test is not really needed. They want to make use of the equipment and make money, or want to get the money and cash. So you are using it. So that sort of thing should not be there in clinical practice. That will have a bad name, and the customer who has come to your hospital, he will never come to your hospital, because they will think that you are unnecessarily doing the investigations. Then the state-of-art surgical equipment, management of complications, that has to be done, and adequate follow-up is also required to get the client who has already come to your hospital. Then of course the other modalities like counseling, convincing, personal touch to patient, and empathy is also very important factors in reaching the reached patient. So already a client who has come to hospital, to attract him, these all strategies you have to employ in order to increase your private practice. Then certain opportunities are there like daycare attendance, inpatient and their attendance, waiting area has to be taken care of, market new product strategies, patient advocacy, patients group discussion is also very important with the patients, that from patient's perspective what all things you have to incorporate in your practice, or how you can change your routine model. So that is also important, because patient can give you a good insight that you can think accordingly from your side that yeah, this is correct, but then patient will tell, oh no, that is not correct, you have to do like that. So you have to welcome such thoughts from the patients. Then second part of my talk is about the capacity building. Now once, this is a short presentation about the capacity building. Once now you have built the clients, now how to increase your capacity. Don't keep on adding many doctors to your organization. Like we in our hospital, we do about 200 surgeries per day and see 800 patients per day. But it is not that every doctor who is coming and showing his biodata we are admitting, or any nursing staff is coming we are admitting to hospital or giving employment. But the capacity, the existing doctor or existing staff which is there, you try to get maximum work done from them. So that is the main aim of the capacity building. So capacity building is basically joining the basic skills, learning attitude, as well as the additional work like providing support, then the multi-purpose workers and personality development. The capacity building, again, the good infrastructure, clinical, educational skills transfer and research. Then in capacity building, resource is also very, very important. So whatever the employment you are taking, or how the person, his attitude towards work, his approach, or whether he has come to hospital just to get his salary, or really he wants to do more work, and his performance, his capabilities, his identification, whether he is a unique feature to get more patients to your hospital. So all those things, they have to be taken in consideration in capacity building. Then performance measurement, target versus achievement, return on investment. Don't invest unnecessarily on the hi-fi equipments and all. So again, think for return on investment. And then resource strategies, then the effectiveness, the non-functional, functional, and economical, the blend of financial and non-financial things you have to make for giving adequate results to patients. Then again, in your medical stores, purchase, stock consumption, monthly maintenance forecasting, all these strategies you have to develop in order to save money and give maximum this thing to the patient. And human resources, the staff, motivation, commitment, satisfaction, and active participation. So to make the human resource in a running state and to make him more happy, you have to employ. So I think I am running of time. So certain awareness, like become a part of the All India Ophthalmological Society, then Vision 2020, collaboration, help, and all you have to employ in that. So in nutshell, the demand generation is wherever you want to get more patients, and capacity building is whatever existing staff you have to motivate them so that that staff can do maximum work for you, and the adequate utilization of all equipments you have to think. Thank you very much, and thank you, sir, for giving me the opportunity.
Thank you, Dr. Saab.